So I get this question a lot. Should I use a foam roller on my middle back or should I use a medicine ball on my middle back? And I think there's really two reasons why the medicine ball is far superior to the foam roller. Although everyone has a foam roller, it's easy to do, lots of people are used to it, but that doesn't mean it's the best. So anyway, point one with how the ball is better than the foam roller is that if we're looking from the side and I lay over this thing, my spine's in the middle, my ribs are on either side. Where do the ribs go? They get pushed up, right? How many people already have their chest too caved in, their ribs already pushed forward? We actually want to open up back. And so if I lay over the ball and my spine is over the center, my ribs are actually going to be able to drop down and open up. So it's going to facilitate a better chest opening, a much better chest opening with the ball than the roller. Along with that, because the diameter is different, this is a bit sharp and this is a bit more gradual. So you get more of a stretch across the joint with the ball as opposed to the roller. The roller is not bad in this respect, but is a little bit more focal in its bend. And with the ball, you get a little bit more of a tractioning, opening type of thing as opposed to just a sharp bend. So the second big difference between the two is the ball gives you a lot more movement options. So when I'm laying over a medicine ball, I can bend side to side, I can twist, I can move, all these types of things, versus with the roller, if I'm laying over this, I basically can flex and extend, maybe a little bit of lateral bending, but I cannot direct the force in any direction I want. So this, you know, I can press it up this way and kind of move a little bit, but with this, if I'm laying over this, I can press this way, I can direct the force this way, any which way I want, I can do with the ball, which is what we are really trying to do when we are trying to mobilize your spine, is get all of the accessory motions back with your spine. A truly functional spine has freedom of motion in all directions. We're not just talking about flexion, extension, lateral bending, all these things. That's not where we live. We are trying to bend and twist and do all these combined motions. And if you can't do those combined motions, you're going to have problems. So medicine ball, I think, is the clear winner. Okay, so you may be wondering, how do I actually use this ball to increase my spinal mobility? Start with the ball on the ground and lay back with your upper back resting on the ball. Most people are going to find they want a yoga block under their hips, and they're also going to want one under their head to take off some of the pressure from the ball when you first start out. Otherwise, it can feel like it is too much pressure initially. What we want to feel is that you have a good stretch on the ball, but not so much pressure that you feel like your chest is tightening up and protecting yourself against the pressure of the ball. You actually want to allow things to relax and melt. If it's still too much pressure, arms crossed takes off some of the pressure. Next baby step up is arms out to the side. You can move your arms up to get different tension spots, but ultimately most people are going to find that having their fingers crossed behind their head gives them the best way to control the pressure and also to move, which we'll talk about in a minute, ways to direct the force. So now that we've got our body arranged, now that we're relaxing at least somewhat comfortably, what do? We wait. We wait for at least 30 seconds, but maybe as much as a minute or 2 minutes until you feel like your body has relaxed. And no one can really tell you exactly what that feels like, but you should feel like if it's uncomfortable, it gets significantly less comfortable. Sometimes people will feel their body shift or move a little bit. Sometimes people will feel little cracking sounds as the joints are cavitating. That's all okay as long as you're being gentle with it. But once you feel like that spot has given all it's going to give for that day, you're going to move your body up so that you get a new patch of tissue. And I'm going to move up until I feel like that stretch ramps up again. I'm not moving an inch. I'm not moving 2 inches. I'm not moving any specified amount. I'm moving just enough that it takes to increase that stretch again. The idea being that we want to build a wave of pressure or a full stretch of the tissues without coming off the tissue. So said another way, if I was to lift up, move, pick another spot, I would get this sort of hunt and peck sort of stretch in the spine. And what I want instead is to get the whole spine to loosen up. So by not picking myself up, it allows me to make sure that I get the whole body to loosen up in a way that gives me the best response. So then I've got my next spot here. I wait another 30 seconds or a minute or so, and then I'm going to keep moving down. I'm going to move the blocks out of the way to make it easier to show the next couple parts. So most people are going to find something in the middle of their back that slows them down and feels like they've gone kind of into something that is a bit more uncomfortable and needs some extra work. So that extra work is going to come from doing a cross-plane motion. So we're extended like this over the ball, then I can maintain that extension as I bend to the side. I can bend to one side, bend to the other side. I can rotate one way or the other, and I can combine all those two things, giving the ability to move the spine all the different directions, recognizing that every joint needs to be able to move in all the directions it has available, not just one. And so that's one of the benefits of the medicine ball over a foam roller, is we can open up all those motions. Eventually you get down about halfway down your spine, it's going to feel like you're sort of seesawing up and down. At that point, I usually like to rest my head on the ground, and then my hips are the throttle on this stretch. So if my hips are up in the air, I've got less pressure on the ball, and then as I extend down, allow the hips to drop down, I get more pressure on the ball. And then I keep working down until I get all the way down to my low back. The medicine ball is relatively safe for your low back because once I'm on my lumbar spine, I'll be actually touching my sacrum and my thoracic spine at the same time, so both kind of ends of the spine are supported. And so some people say don't do extension over a foam roller or things like that because it's too much of a sharp fulcrum, and that may be true for some people. They probably should avoid it, but this is pretty safe for most. If it's not feeling good, don't do it. So then once we're all the way down onto the low back, then we can move out to treat the right SI joint. So I'm going to move the ball down below belt line, and I'm using the ball as a block on my sacrum. So I've got the ball is to the right and inside the ilium, kind of a difficult concept here, but we're below the belt line and just off to the right. Then I'm going to lift my leg up, bend the leg out. That's going to allow my ilium to shift back, and then we're going to do the opposite and go all the way down like this. And we're moving these two directions, pausing at any spot that feels tight. So it feels very tight for me here. I might just hang out on this spot. I can move my hips back and forth a little bit. I can move up and down a tiny bit, but the goal is to get this SI joint loosened up. I'll do both sides, and then I'm going to work all the way back up without taking pressure off the ball. So I'm going to work, all the way back up, all the way back up, all the way back up, and then sometimes if I have a particularly sticky spot, I'll come kind of down to that spot and then back up and then down to that spot, sort of work towards that spot. Again, I can laterally bend, I can move, I can extend over the ball, I can elbows tight and flex up. All these things are ways that you can increase the stretch or direct the stretch in a way that you cannot do as effectively with a foam roller. Now, most people, when they're first starting this out for the first maybe month or so, maybe 2 months, are going to feel like they just can't get all the way down. And that's good. You don't want to go past that point, which it feels sketchy. Don't go past that point because most people will find that something roughly in through here is such a block that they can't get past it, and it's too tender. Even if they use yoga blocks or whatever, they just can't get past it, and it would potentially cause more of an issue blowing right past it and trying to get down to the low back. Don't go there yet. It's important to work top down on this so that you get all the segments to loosen up in all the different ways, and that point in your mid back becomes that working point that you're trying to chisel away at very slowly, millimeter at a time, day after day. It might take you, again, weeks to maybe months to get through that spot, but be patient because it is definitely worth getting through that point.